Welcome to the Longevity Formula with Dr. Brandon Crawford. Let's explore the new era of wellness.
Hey everyone, welcome to the Longevity Formula. Today is kind of interesting because this is an impromptu episode that we're going to record. So I'm actually sitting here in my home with my wife, Sarah. And today's one of those days where I'm catching up on several different business things. So I'm in between meetings and, Sarah's over here working on her things, right? So she acts as our chief of operations for all the different businesses that we run. And so she's over here working, I'm over here working. And we just start talking about the recent events that transpired in regards to the announcement with Tylenol or Acetaminophen and its correlation with autism and neurobehavioral disorders or neurodevelopmental disorders. And one thing led to another, and Sarah pops up and she says, "Let's record this. We got to talk about this on camera because there's so many things, that have not been said, so many things that have been said that are kind of ludicrous, that don't really make a lot of sense. And so let's just kind of, wade through this. So first of all, thanks for joining us. Mm-hmm. I appreciate your time. So let's first start with a bit of a summary, just so that we're all on the same page as far as what has recently transpired. So yesterday, the FDA announced it will update acetaminophen or Tylenol labels to warn that prenatal use may be associated with higher rates of autism and ADHD. Large observational studies have shown links, but sibling and other controlled studies have not confirmed causation. Experts emphasize that the overall risk increase is small and confounded by factors like fever or infection, the very reasons people may actually take Tylenol. The FDA's current guidance is for pregnant women to use the lowest effective dose for the shortest duration possible. At the same time, health agencies like the EMA and WHO maintain that acetaminophen remains safe when used appropriately because untreated fever itself can endanger pregnancy. The bottom line is that this is a developing story. The science is still inconclusive and more rigorous research is needed. And I thought it was also funny that didn't Tylenol do a post last night that said something like...
No, it wasn't last night. It was in 2017.
It was 2017.
Yeah, that was like, we don't recommend that pregnant women use any of our products.
Interesting. Okay, so...
But then they came back and there's been other things said, but still it's said.
So I guess I don't know where you want to start, but the place I was kind of thinking about starting is this is not exactly new news.
No, it's not new. We've never had Tylenol in our house. We've never given it to our children. You've always told me it's not great. Please glutathione and let's not take it. And actually, the biggest reason why we haven't taken is, are you aware that the mechanism of Tylenol, acetaminophen, is unknown?
It's not fully elucidated, right? It's
been theorized. I mean, I'm looking at a tough study right now. Like, it's widely known that no one knows the full mechanism of action for Tylenol.
So just to kind of give a little background into that. So in the functional medicine communities, it's always been, kind of a discussion of if we're going to be recommending something, whether it's a medication or even over-the-counter medication or supplement or herb or something like this, we need to first investigate the mechanism of action. What exactly is going on in the body? How are you metabolizing this substance? And that lets the provider know what areas of the body or metabolism or physiology is being stressed when you take this substance, right? And so when you look at acetaminophen, it's largely unknown. We do know, right? And there's several studies that tell us when you take acetaminophen, it does actually deplete glutathione levels. This is not new.
Well, and how many comments have you had? Back up your claim, back up your claim. There are a ton of studies that talk about
there's several,
the
yes.
Glutathione depletion when you use acetaminophen and even in small dosages.
So knowing that and knowing that glutathione is vitally important for us to have in our system to protect our brain, to protect our body from oxidative stress of any type, right? This is going to help prevent autoimmune disease and autoimmunity. This is going to help prevent and help us navigate life as healthy as possible. It's also going to help us detox our systems, right? So it helps us get out all the junk, right? So if you have impairment in glutathione, you're setting yourself up to have any type of, health problem, essentially. And so that's why, we've always, my recommendation, what we've always done as a family is we've never actually used acetaminophen or Tylenol, right? Now, there's the flip side of this is, well, what about non-steroidal anti-inflammatories such as ibuprofen, right? Mm-hmm. And so in my functional neurology early years, I actually looked at and studied a lot of Dr. Russell Blaylock's research. Dr. Russell Blaylock was a neurosurgeon, and he actually would comment about the use of ibuprofen. And he specifically was talking about how this can downregulate the glial system. So your microglial cells, right? So the resident immune cells in the brain. So if you did have some kind of insult or trauma or, neuroinflammatory event or something like that,
which happens with fever or head injury,
stuff like this, he would argue, and he wasn't necessarily suggesting it, but he was saying, perhaps the use of something like ibuprofen could be beneficial for some of these patients. Side note, there's also research that shows if you use non-steroidal anti-inflammatories for mild to moderate head injury, it can prolong effects from the head injury. So I'm not saying use it. I'm just saying that if there were instances where we had to use one of these things, it's always been ibuprofen. I don't know where I was going with that, but
it happens when your kid has 105-degree fever that ramps up in the middle of the night. There have been times when that's happened in our house, and it's not wonderful, and your kid is not sleeping and they're not resting, and half a dose of Advil has popped it down to be 101, 102, and the kid rests and is able to eat.
And I think, we should kind of expand on that just a little bit, because yes, we try to be as holistic as possible, but we do that within the confines of using medicine when needed and when it makes sense. Mm-hmm. We are not dogmatic in any stance. We will not dig our heels in the ground and say, we do not use medication, period. No, it's always a discussion of risk versus benefit. So that's kind of our stance here, right?
We're not antibiotics. When a kid has an abscessed tooth, he get an antibiotic.
Right. So while we both acknowledge that fevers in and of themselves can be healing, I also have had patients where a fever did trigger, like one patient that comes to mind specifically, it was a little baby, and it was actually a chiro colleague. Their baby let their fever run, let it go. And then all of a sudden it triggered some massive seizures, which then, turned into an encephalitic syndrome, and he developed brain injury. So that always kind of lingered with me. Now, I would argue, at this stage in my career, there were other compounding factors at play that they did not know about, et cetera. But again, we try to be as holistic as possible, but we navigate, best we can with common sense and with science and data behind us.
Correct. Well, I think it's important just to note, just to answer the question. Here's a study from 2005 talking about acetaminophen decreasing glutathione levels.
And modulating cytokines.
Cytokines. Isn't that a word we've heard a lot from COVID vaccine and getting COVID naturally? We'll circle back to that. There's a 1993 study. This is not new news. This all came out before we even had children, right? The depletion was 53% in the macrophages. I don't know these words. And 34% in the pneumocytes. And this is talking more on, it's a rat study, but it's still important to note. This is not new things.
That is a good study. Yeah, absolutely. From 93. Yeah, absolutely.
Here's a study. I don't have this sticking data.
Dose-dependent pharmacokinetics of acetaminophen, evidence of glutathione depletion in humans. Again, yes, a well-cited, well-done study there. Again, this is not new news.
No, it's very simple. You go on Google and you search acetaminophen and glutathione, and these research is complete.
Right. You can go to google.com/scholar, and you can use Google Scholar to actually start to.
And these are not holistic juju studies. These are done by.
Yeah, these are reputable journals. Absolutely.
So nothing's new. We've known about this. And I saw a doctor in OB the other day, and she wrote, it was like yesterday, she was commenting why didn't we know this? Why aren't we taught this? But also it's important that your doctor is continuing to research. Just because what you learned in medical school or what you learned in chiropractic school, I know you change regularly, right?
Oh yeah. Absolutely.
You have to stay up to date with the research. You have to stay up to date with what's happening.
A good physician is never going to be okay with the status quo. And we have to understand that what we learn in our, whether it's medical training, DO training, chiro training, PT training, NP training, whatever your training is.
Neurosurgeon training.
Yeah, exactly. No matter what it is, a good amount of that information is actually antiquated while you're going through your training, while you're going through your academic career. And if you're going to stay on the leading edge, you actually have to do that yourself. Like you actually have to read current research, including case reports, including white papers. And not only that, but also collaborate with like-minded and non-like-minded colleagues, right? Reach across the aisle, right? That I actually do this. I will talk to people with opposing views because I want to know, am I right or wrong? And so you should always be sharpening your mind. Do I or do I not read research almost every single day?
Yeah, well, at nighttime, it is like, what are you reading? And it's words I can't pronounce, but I'm like, oh, it's comforting. It's comforting to know that I have this nerd in my head who is constantly reading research. And you have to do that. Like if you're a physician and you're treating patients, you have to stay up to date with the research. You
do. And so what I would say to these providers that are saying, why didn't anyone tell us this? Shame on you. Mm-hmm. Shame on you for not doing your own due diligence, maintaining your own oath, right? To do no harm, because the information is there. And if this is something, if you're regularly recommending acetaminophen to your pregnant patients or to your children upon receiving vaccines, which we can talk about that, do your diligence and think, man, if I'm recommending this, is this really the best thing to recommend? Is there something else? Should I be recommending, if they have pain? Well, what's wrong with recommending chiropractic care or PT or massage or acupuncture or I mean,
a hot bath.
Right. Or I mean, look, there's even Dr. Sarno wrote a whole book and has a whole, I guess you can call it a theory behind how emotional traumas actually cause back pain and things like that. There's multiple avenues to explore for pain and pain while pregnant.
Yeah.
Okay, then let's talk about fever.
Yeah.
Okay. Well, because I was actually interviewed on the news and the person interviewing me, she kind of wouldn't stop. She was like, well, what about if a pregnant lady has a fever? What are you going to do?
Well, okay. I also think it's pretty silly. Like your body does it have mechanisms in it when you're pregnant? I think when I was pregnant, I was the healthiest I've ever been in my life. Is that how normal pregnancies go?
It kind of depends. I mean, that is highly variable.
Okay.
For some people, let's say it's autoimmune based. Typically, you'll see a downtrend in the autoimmunity while pregnant, right. And you'll actually see these periods where autoimmune markers fall off. For some people, however, pregnancy can trigger some type of emotional trauma, et cetera. And those people may actually have a flare up of symptoms. So it's a very personalized experience based on their limbic system, their past history, okay. Their all the things, right? So
there's pregnant women who are one of it you just heard. But no amount of Tylenol or Advil or anything is going to get the baby off your Q bone when you're 9 months pregnant.
Well, let's just talk about the physical mechanisms of why you hurt, right? You don't hurt because you have an acetaminophen deficiency. I think that's obvious. But yeah. What if you hurt because your pelvis is not moving correctly because of the added load from the baby and the amniotic fluid and all the things? That's a great case for chiropractic care.
Well, and I'm pretty sure chiropractic care is kind of widely recommended when you're pregnant.
I hope so.
Maybe it's not. I wouldn't understand why not.
I mean, obviously you want to see someone that is properly trained and comfortable treating pregnant women and all of these things, but that's relatively easy to find. But let's say that you're just staunchly opposed to chiropractic. There's physical therapists that specialize in pregnancy care. There's massage therapists that specialize in pregnancy care. Acupuncture was actually really good for you. I mean, mm-hmm. You did acupuncture when you were pregnant and got relief as well. So, I mean, there's approaches that are better and safer than taking acetaminophen and do not carry a risk or correlation with autism or neurobehavioral disorders or other chronic diseases. So why not turn to that before turning to acetaminophen or something else? Right. Anyway. Okay. So what do you want to touch on next? Where do we want to go?
Well, I mean, I think, on social media, what I've seen, of course, is parents being like, why are they talking about the vaccines? Why are they talking about the vaccines? Well, Trump did talk a lot about the vaccines.
So let's okay, let's go there next. Because if you listen to the full announcement, Donald Trump did come on and he was trying to get a message across. And it appeared as though he was off script.
Yeah.
Which I don't know. Maybe he was, maybe he wasn't. But it appeared.
But it was a bit of a tangent.
It was a bit of a tangent. It appeared that he was off script. But I personally, this is me talking. I personally think that no matter what your opinion is about Trump, when he speaks, there's a purpose. Like he had something he was trying to communicate, right? He's not one to just get up and just say, well, I won't go there. So he started in on the vaccine discussion, and his discussion really revolved around break it up, break it up, break it up. Don't take all of these shots together. Like he was really messaging a caution in regards to vaccine use. To me, it seemed as though he was really trying to portray that he was concerned with the amount of vaccines that babies are receiving today. But it seemed like he was somewhat restricted in what he could really say. Does that sound?
Of course.
Yeah.
As anybody feels the need to be restricted of what we say about vaccines. It's a hard place to just come out and talk about.
It really is.
Yep.
And, I think there's a few people in the market doing a good job with that. I think Dr. Joel Gator is doing a fantastic job. Highly recommend his book, Between a Shot and a Hard Place. I've got several copies in my office. I've got one on my Kindle. So, I want my patients to have access to it. But he does do a good job of really just going through the facts, right? And talking about this, because while I'm not going to sit here and say that vaccines directly cause autism, I think that, again, it's one of many factors that need to be included in the discussion. Just like this whole concept with acetaminophen. It's one data point. It's one factor that needs to be included in this discussion.
How do they play together? How would Tylenol usage while you're pregnant or I know they weren't talking about it in children, but let's talk about it.
No, they did. They included the discussion did actually include, because a lot of times what will happen is they'll recommend give acetaminophen or give Tylenol when you get a vaccine to reduce pain and inflammation.
Right. So we know it's fact that Tylenol can reduce your glutathione stores. What is the importance? You've talked about the importance of glutathione in a normal individual, but why is glutathione so important when you're also getting vaccination?
So when you're getting a vaccine, so let's talk about what a vaccine is. A vaccine is designed to stimulate the immune response. And you cannot separate immune from inflammatory response, right? These are one and the same systems. So a vaccine by design is there to actually stimulate an immune response. Now, here's the problem. For some people, they're called low responders. You're going to get a minimal response. For some people, you're going to get what they call adequate response. And then for others, you're going to get an exaggerated response or a hyper-reactive response. And so you have your low, middle, and high responders, right? And so the problem here is that for those people that maybe the immune system, the immune inflammatory systems are overactivated, they need things like glutathione to protect from that overactivation of the immune and inflammatory response. Mm-hmm. And so if we deplete it, we just lost some of the ability to protect us from this overactivation of the immune inflammatory response. So that's, in a nutshell, why this is correlative, why this is not a good idea to take acetaminophen in combination with vaccines for kiddos, but also, why you don't want to deplete it in mom.
Well, it talks about low glutathione can blunt proper immune training, possibly altering both natural infection recovery and vaccine response.
True. Yeah, absolutely.
So does that mean like your body may not be able to fully absorb the vaccine? The thought is the vaccine antibody absorption?
So you're losing the ability, you're blunting the ability for that vaccine to create the supposed antibody response that gives you longer term immunity from whatever you're being vaccinated against.
Yeah. Yeah. Interesting.
It is interesting. And definitely a discussion that, needs to be furthered, right?
Yeah.
Why aren't we really going into this. Let me pull something up because there was an interesting study.
Oh, well, also how we talked about like glutathione in pediatric patients.
Okay, so the question is, should we be taking glutathione? Okay, my preference, so the response is going to be dependent upon the provider that you're working with in this regard.
Correct.
Because some evidence is going to say, yes, take glutathione. Other providers are going to say, I'd rather you be able to make your own glutathione.
Like NAC?
You can take N-acetylcysteine. You can take various, other precursors that's going to help with glutathione production. First and foremost, let's just acknowledge that if your body makes something, it's always going to be better if you can make that yourself, because your body is going to know how much of it is needed. It's going to know when to use it. It's going to know when to upregulate it, downregulate it, et cetera. Everything is going to be subjected to what's called a hormetic curve. Mm-hmm. So there's always going to be a low dose, a just right dose, and a dose is too much. That's for everything. That's for water. That's for oxygen. That's for everything. If you get too much of something, it can carry some negative effects, right? And so that's why, IV glutathione makes me feel amazing, but that's probably because I'm stressed out, I'm tired, I've got autoimmune issues, et cetera. So my glutathione levels are typically on the low end. So if I do a IV glutathione, I feel freaking amazing, but I'm not going to do it every day because it's going to be too much and it can cause harm.
But as someone who has proper glutathione, can you test for that? Can you test your body? Is there a blood test to see if you have proper glutathione?
You can measure glutathione levels. You can also conclude if someone can properly make glutathione. You can measure their oxidative stress markers and draw conclusions. There's markers on the urine test, which is the OATS test that you can do to draw conclusions about oxidative stress status and glutathione levels. So yes, you can mostly indirectly and sometimes directly measure glutathione levels. Okay. Yeah. What else are we going to talk about that?
Well, just other ways that people can increase their glutathione, knowing that we're, all coming in contact with things that are possibly depleting it.
Okay, so let's go back to how we are designed to live, right? Because I think we have to start there before we talk about, taking supplements or medication or anything like this.
Does sunlight help? Does sleep help?
Sunlight absolutely helps. And I think the first thing to really talk about here is circadian biology. If we are designed to be up and awake with the sun, be asleep when the sun sets, to eat when the sun is up, to not eat when the sun is down, to not be blasting our retinas when the sun is down with light, et cetera. Like there is a definite circadian rhythm that we are supposed to be living in. And this is going to affect everything. This is going to affect our hormones, our cortisol, our blood sugar, our inflammatory markers, our glutathione levels, all of the things, right? So we have to do some base level things first to really give our bodies the best chance possible to actually regulate and to produce the neurochemicals and all the physiological things that it's supposed to be doing on a regular basis. So what does that mean? That means observing the sunrise. This is the most important time of day to be outside to see the sunrise. It's the purest form of red light. This actually gets the TCA cycle spinning in the right direction so that the Krebs cycle can actually produce cellular energy. So all you people doing the carnivore diet and the high protein diets and all this kind of stuff, that doesn't really effectively work if your TCA cycle is not actually spinning to make all of this stuff actually work for us. And so even your diet is dictated, the effectiveness of your diet is actually dictated on your circadian rhythm as well. So this is everything, right? And then being outside at solar noon, whenever the sun is at its peak, this is where you have longer wavelengths. The far infrared spectrum is a little higher here. You get a deeper penetration. It's phenomenal for gut microbiome to be outside, get your belly exposed, et cetera, which by the way, you should do when you're pregnant as well, because a developing baby needs to be exposed to sunlight as well, right? Just think about it. As that belly is growing and expanding and the skin is thinning, it's actually increasing the ability for light to penetrate into the womb. I think there's a reason for this. And then also observing the sunset, being outside, because again, this is a dramatically different wavelength of light, combination of wavelengths of light, helping you prepare for bed, downregulate the systems, et cetera.
When you feel that.
Yeah.
Like you feel there are people who really most people, like, it's a beautiful thing to get to experience the sunrise.
Yeah.
And it is a calming and beautiful thing when you watch the sun set. It's like we were meant to observe that every day and not be in our house.
Absolutely.
Yeah. Well, even the research says, like,
I wasn't done.
I'm sorry.
Okay. Then, but because here's the most important thing, because I think this is where most people fail. After the sun is down, most people, maybe they did, sorry, I've got allergies. Maybe they did all the things right. They observed the sunrise. They were outside midday. They observed the sunset. But then they go inside and they turn on the TV, or they get on the computer, or they get on their phone or their iPad or whatever, and they're blasting their retinas in their body with a very high frequency white and blue light, which is not supposed to be present at that time of day. This alters circadian biology. This alters circadian clock genes. And this actually raises blood sugar. This depletes glutathione levels because it's having to kick in to protect yourself. This promotes autoimmunity. This spikes blood sugar. This sets so many different things in motion that are not good. And when I was talking to a news reporter and she asked, how do you support glutathione levels? And I told her this, her eyes glazed over, like, what's this guy talking about? Because no one else is really talking about it. Now, are there other things to consider? Sleep cycles, sleep efficiency, absolutely. You were talking about vitamin D, absolutely. Maintaining adequate vitamin D stores.
And synthesis happens mainly at nighttime.
Absolutely.
So if you're not sleeping, then you're not getting that.
Yep.
It's important.
It's very important.
So light and night.
Yep. Absolutely. So very important. So yes, are there other things you could do, other supplement considerations? Can you take glutathione directly? You can. I would just say, I would feel more comfortable saying work with your provider that actually knows you and your situation than giving a blanket statement here, because there's so many different ways to navigate the need for glutathione support for each individual. Sometimes we give them glutathione. Sometimes we support their detox systems. Sometimes we go, you really need some vagus nerve stimulus, and we need to actually turn the neurophysiology on, right? Sometimes you actually need a neurological stimulus, and you need to create neuroplasticity so that these systems actually work.
And then there's precursors to glutathione. Is that melatonin a precursor to glutathione production?
Melatonin, it's going to be produced in the mitochondria. Melatonin also helps protect the mitochondria, similar to glutathione, right? Okay. So it's going to be doing similar things, obviously very different things as well.
Not saying we should give your kids glutathione. I mean, give your kids melatonin. It's like tiny doses, and you make it naturally. So
what you're thinking about, if you take larger doses of melatonin, you can actually generate the entire cascade of glutathione. So this whole cascade of events that needs to take place in order to produce glutathione. You can do that. I always advise, my preference is not to do it orally, but to actually do it topically or via suppository if we're getting into those higher doses, like above 5 milligrams, obviously lower in kids. So I think that's what you're thinking about there. So yeah, taking melatonin can lead to glutathione production.
Okay. Anything else you want to unwrap?
Well, you got me thinking, because there was a study that came out and no one's talked about it. And the title of it is The Impact of Childhood Vaccination on Short and Long-Term Chronic Health Outcomes in Children. This was a birth cohort study. And it was really interesting, right? So it looked at 18,468 children from 2000 to 2016. It looked at vaccinated versus unvaccinated populations.
Why didn't they ask more of us unvaccinated to participate in the study?
I don't know. So yeah, Sarah's saying there's looking at the numbers, 16,511 were vaccinated and then 1,957 were unvaccinated. So yeah, I would have liked to see more in the unvaccinated cohort as well. I think that would have added benefit for sure. But that being said, this is still a rather large study, and it's still good data. And I would argue in my opinion, it's better data than this discussion around Tylenol.
Yeah,
because now you're actually looking at a completely, two opposing cohorts, and you're looking at things like any chronic health conditions, asthma, atopic disease, autoimmune disease, neurodevelopmental disorders, mental health disorder, cancer, food allergy, and looking at, is there a difference in the prevalence of these things in the vaccinated versus unvaccinated populations? So the answer is yes, there's actually a huge difference here. So when you look at the numbers, you have any chronic health condition in the vaccinated population, you had 277.3, and the unvaccinated 111.7. That's in the unvaccinated favor. Asthma, 145.6 versus 35.6. Again,
that's probably the largest one.
Again, a big discrepancy in the unvaccinated favor. Atopic disease. So this is like skin disorders. Like I said, 41.2 versus 15.6. Again, in the unvaccinated favor. Autoimmune disease, 8.4 versus 1.4. Unvaccinated favor. Neurodevelopmental disorders, 50.2 versus 8.2.
That's huge. Why aren't we looking at
unvaccinated
this?
favor, right? Mental health disorder, 15.9, 4.5. Cancer, 7, 8.8. So there's negligible. That's the only one that kind of tipped in the vaccinated favor there, which is interesting.
Yeah, that's very interesting.
Food allergy, 24.3 and 20.5. So relatively even there.
Yep.
So what is, why aren't we really looking at this? What do you think?
I have no idea why we're not looking at it. I think they are looking at it. Like, I think that there is a huge importance to some of the things that have been said, giving parents more choice, not pressuring them into vaccinating. What do they say? Where there's a risk, there has to be like choice.
Mm-hmm.
If there is risk, it's noted. It's in the vaccine inserts. It's in the study.
I don't know that I think some providers are doing a good job of giving choice and respecting it. But we had a patient in, not that long ago that literally described how they were coerced into getting vaccines for their kid. They literally, and I'm not exaggerating, they were not saying they were unwilling to vaccinate their kid. They were simply questioning and they were wanting to delay and they had concerns. And their doctor basically told them that, number one, they were not going to be a patient there anymore if they did not vaccinate. And then they had other physicians come in and tell them how their kid was going to get disease and potentially die and all these things and coerce them into vaccinating their kid. And then their kid regressed and developed what appears to be autism,
right?
Nonverbal severe
and that
autism.
happens time and time and time again.
I hear it a lot.
And it's a statistic until it happens to your family.
Exactly.
Or until it happens to one of your patients.
Yeah.
And it's heartbreaking. Thankfully, it's a low risk, but.
Look at this. Other notable findings, the 10-year probability of remaining free of a chronic health condition. So meaning over the next 10 years, this is the probability that the cohort will not develop a chronic health condition. Vaccinated group, 43%. Unvaccinated group, 83%.
So they're almost twice as likely to have
not have
a decade
a chronic health issue.
Chronic, yeah. It's interesting.
And again, that's coming out from the study that was published.
Well, I also think that, we go back to talking about making sure that you're seeing a doctor that's read up on the most recent research. Well, is your doctor even read up on the vaccine safety insert of the vaccine they're about to inject with you? That was something that I saw. I was shocked. Like, there are times of different vaccines you should not receive if your kid has a high fever, if your kid had an ear infection, if your kid has even a low-grade fever. How many times have we heard of people who go to the doctor, my kid is sick, they have strep throat or they have a virus, but their doctor's like, well, you're due for vaccines next week. Let's just go ahead and get them done. Is that concerning?
Of course it's concerning. The manufacturers themselves are telling the doctors, if you're sick, if you've had recent seizure, if you've had a brain injury, if you have encephalitis, I don't know, do you have a list of all these things? I'm just going off of what I know. I was reading some stuff
that was pretty interesting, like the rotavirus vaccine. I know we've had patients that have had intussusception or like GI malformations. Yeah. I wonder if their doctors have talked to them about the rotavirus vaccine.
Yeah.
Or there's things in here that say like, if you've received, say, let me find this one. It was really interesting. Like if your kid has received a vaccine, was it the Tdap? Tdap. Yeah. So like say you get a form of vaccine and your kid has a slight reaction that you think is a reaction, right? Mm-hmm. Maybe it was like they were uber fussy afterwards, or we've had patients come in and their kid was dragging their feet, not able to walk for a couple of days.
We did. We had paralysis following vaccine.
Or had something that looked like a movement disorder, like is that a seizure? Like, hey, doctor, the day after my kid got this vaccine, this is what happened. And the doctor says, oh, that's nothing, don't worry about it. But the vaccine inserts actually say, if your kid had XYZ or had a weird immune response to this, then we should pause, take time, look into that, or not do the vaccine ever again. Right. Is your doctor listening to you? Are they taking you seriously? And I know that you as a parent, you as a physician, who do you listen to?
The mom.
Who do you never silence?
The mom.
Because we are so connected to our kids, like you have to listen to us.
Yep.
Like that gut feeling you feel in your heart, sometimes you have to listen to that. You should listen to that always. It's in us innate as we are humans.
Absolutely. Even if it's a concern, even if it's like, hey, look, I'm not saying I don't want to do the vaccine. I'm just saying that last time we may have seen a response and we're a little concerned about it. Like that should be investigated.
Yeah.
Like you can even for some of the adjuvants in vaccines, like formaldehyde, you can actually do panels to see if you're reactive to formaldehyde and other heavy metals and chemicals. Yeah.
So the IPV vaccine, the inactivated polio, do not give if there's hypersensitivity to components, including words I can't say, but including formaldehyde,
neomycin, which is an antibiotic, polymyxin D.
And this was super interesting to us because our son Nolan, almost 15 years old, we did blood work on him a while back. Over the last 2 years, his formaldehyde has been in the red.
Correct.
Signaling to us that his body isn't coming in contact with any crazy amounts of formaldehyde, but he's not detoxing the way he's supposed to. So what would have happened to him if we would have given him?
I don't know, vaccines? But I don't think it would have been good.
But why aren't we testing? If you're going to give a vaccine to a kid that has these risks and says, do not give if you have issues with this, do not give if you have issues with this, you can test for those things.
A lot of these things you can test for. So why not try to make it safer? Why not say, hey, look, the manufacturers themselves are saying, if you have a sensitivity or any issues with these components, do not give the vaccine. Yet we're not investigating, do my kids actually have issues to these things? Mm-hmm. It's very conflicting.
Right.
Yeah.
One that's so many of the vaccines, like the DTaP, do not give if they have a progressive neurologic disorder, including infantile spasms, uncontrolled epilepsy, progressive encephalopathy.
Until stabilized.
How many of our patients, their doctor completely disregards what's in the vaccine insert?
Yeah, absolutely.
And pushes them and pressures them.
Sometimes actually adds additional and saying we need to do more.
Yep.
Yeah.
So you can wrap that up, but
seems a little irresponsible to me.
Faceted. So it's not just the
right. And I guess we should say, just reiterate, we're not being dogmatic. We're not saying no vaccines ever. I'm just saying the concept, the idea of them is good. Let's not get sick and let's prevent disease and let's do all these things. But there's so many questions unanswered, but there's also data actually given out by the manufacturers themselves. And now we have the research that we went through comparing vaccinated and unvaccinated. So we have to start to question, are we really achieving what we're trying to achieve? Like, is it really true that all these diseases really plummeted once we started to vaccinate? We haven't touched on that. You know, when you look at the vaccines back in the day, right?
Once, how many times do we hear, I call them boomers, on social media? There's no way kids can go to school to have vaccines. I was vaccinated with every single vaccine. Like the 1964 vaccine, was it like 6 shots?
It wasn't much.
Like 6 in I was born in 87, so I would have received 12 total vaccines. A 2019 kid is 54.
Yeah.
Like, are we not looking at the vaccine schedule at all? Are we not looking at the amount of things get injected to our kids? And correct. I think some of that is hidden because you have the MMR vaccine, 1 shot. You have they group together so many different things.
True. DTaP, MMR, et cetera. But then something that's not really being discussed is they say, well, you know, we started vaccinating and then we had a dramatic decrease in disease and whatnot. But if you actually scale out and you look at the bigger picture, these diseases were on the very rapid decline
due to
sanitation and nutrition.
Yep.
So that made a huge change. And I would argue, improvements in proper medical care as well. And, and there were other things.
Antibiotics.
You had, was it Dr. Semmelweis that was ridiculed when he said, we should wash our hands before delivering babies. I mean, people are like, you're an idiot. Why would you ever do that? Why do you need to wash your hands? And now it's like, duh, you got to wash your hands before you deliver a baby, or, now we wear gloves. So these types of things were really what was driving this whole concept of, the disease going on.
And you can see that because there are certain things that declined as rapidly as vaccinated things declined, but there's no vaccine for it.
Yeah, like scarlet fever and things like this. So they were declining at the same rate, yet there was no vaccine for them. Mm-hmm. Okay.
Yep.
So just, again, that's kind of yes, there's data behind that, but it's also a common sense argument.
Yeah. Well, I think that's it. I think we wish we could just get to a place where we could respect other people's opinions. I have friends, I have family who fully vaccinate their kids, love them.
Mm-hmm.
That is their choice. That is their choice for their family. This is our choice for our family. We get along and we coexist. But we have to be able to pick apart the data, pick apart the things. And I think I wish that people of higher offices could stop holding back so much and really get to the root cause.
Yeah, I think RFK is trying, but I think there's real obstacles and real challenges that, he has to navigate.
We didn't even talk about the gene issue.
The gene issue. Okay.
How many times do you see, my kid has genetic autism?
Well, there's syndromic and there's non-syndromic autism. So, there's several study groups right now looking at CRISPR, right? So they're trying to find the genetic, or they're trying to identify the gene that causes autism, right?
Which has not been found.
No one's identified it. Hey, look, if they do, fantastic. Modify it, solve the problem. I am not opposed to this, but I don't think they're going to find it. It doesn't really exist. There's syndromic conditions like Rett syndrome, right? Things like this that present with autistic like symptoms. But as a provider that's been in this space, I'll tell you, I can identify I'm not saying I'm 100% accurate, but I can identify genetic versus non-genetic almost instantly as soon as a kid walks into a room. Mm-hmm. They have a different look. They're globally affected. They don't typically have this unevenness of skills. Like they present differently than the type of autism that is running rampant and is escalating at a dramatic and scary rate. Mm-hmm. These are two different things. Right. So yes, there's syndromic causes or genetic causes, but that's not what everyone's pointing to. And that's not what everyone is having a problem with. And that's not what's on the dramatic rise.
No.
How does a genetic disease just all of a sudden skyrocket?
Yeah.
Because, and I don't know if I'll get blowback from this, but if it were genetic, and that would mean that, these autistic kiddos were breeding, they were reproducing with one another and propagating the genes. And I don't think that's happening. Where is the genetic rise coming from?
And you do see, so whenever you have a patient that comes in that has, they're autistic, maybe they have a sibling that has pretty moderate to severe autism. Do you see is there a difference in their family, in the parents, in the dad?
Say it again.
And the mom or the dad, like, are the mom and the dad ever more predisposed to
absolutely.
have a child? Like when you have two patients.
Yeah. So So you have, mom or dad is already on the spectrum, or they're both on the spectrum.
Right. They're engineers. They're both
uber
left brain engineers or
something, right?
Yeah,
they're a very heavy left brain, profession. And then those two individuals get together and then they, have a kid that where those effects were then magnified, right? They propagated a magnification in that genetic tendency or that epigenetic tendency. Sure, we see that all the time. But I've also seen the opposite. I've seen, parents that were complete opposite and they had this autistic kid.
Right.
So, and I will say, just for full transparency and to be 100% like open here, I have a handful I'm going to say one handful, not even two handfuls. I have one handful of autistic kiddos where they were not vaccinated. Mm-hmm. And it's not genetic. So I do have that and I do see that. So again, I'm not saying, and we're not saying that vaccines cause autism. That's not what I'm saying. It is a factor that needs to be considered. Mm-hmm. And I'll go back and point to the light story, because when you look at the dramatic rise of artificial light, non-native EMF and artificial light, this dramatic rise correlates with the dramatic rise of autism and neurobehavioral disorders.
Mm-hmm.
And I think that there's something to that. And that starts to talk to the mitochondrial story. We start seeing mitochondrial heteroplasmy, aka inefficiencies in mitochondria, start to escalate and rise with the increased tech abuse and use of screens and LED lights and, really getting away from the circadian stuff that we were talking about earlier. But by really pummeling our bodies with the wrong form of light, like this actually causes damage in our mitochondria. And I truly think that this is a core component to this whole story.
Yeah.
Because we even talked about how glutathione protects what? The mitochondria. This is a large component of what's going on. So I think the mitochondria is really the canary in the coal mine here. And I think that's really what, we need to be focused on. Yes, we see brain imbalances and all that kind of stuff, but I'll tell you, the hemispheric work doesn't work for every kid.
Yeah.
It's not always a right brain deficiency. It's not like, does that work sometimes? Yeah. But the reason why I started to question it is because it didn't always work. And sometimes I'd see areas in the right that were weak, but also areas in the left that were weak. And so the hemispheric model clinically started to kind of break down a little bit. We still apply it, especially, for the individuals that we can look at, we can say, man, I see all of these deficiencies here. Like, let's really, we can do that. Yeah. But everyone needs to have their own personalized, individualized approach. But the mitochondrial story absolutely applies to all. Yeah. Mitochondrial DNA is inherited from the mom. Mm-hmm. And I believe that's by design because we are trying to eliminate as much trauma response as you can. And so if historically the dad goes out and fights wars or goes out and hunts and all this kind of stuff, the dad is absolutely more likely to encounter trauma. And so evolutionarily, our mitochondrial DNA has been eliminated. This is Crawford conjecture. This is just, things that I've thought through. And so your mitochondrial DNA is inherited from the mom.
That's not conjecture. That's fact.
That's facts, right? Yeah. Mitochondrial DNA inherited from mom. And if you think about what the mitochondrial DNA does, it's kind of like flight control, right? So your genetic code is like the airplanes, but the mitochondrial DNA is controlling all the flights, right? Mm-hmm. So it's really controlling the nuclear DNA and the genetic expression, the phenotypic expression, and all these things. And by the way, it's doing it via biophotons, right? And that's Fritz Popps's work, and that's Roland Van Wyck's work. So again, this is not conjecture. This is just actual data that's been uncovered. And so a lot of what's transpiring is we're developing at a rapid pace mitochondrial heteroplasmy, aka mitochondrial inefficiencies, that is then leading to all of these explosions of chronic diseases, including neurodevelopmental disorders.
Yeah. And it's not that we're not that we're saying that you have an autistic kid and we want to cure them. But
well, they have a unique skill set that I think our society does a poor job of recognizing and incorporating. Mm-hmm. And I think one thing that we should do as a society is look at what are the strengths in this population and how can we best, incorporate them into society. I mean, they can do things that I could never do. I mean, they have a true gift, right?
And you see it every week in our clinic and I'm like, wow, this brain of this kid is unbelievable. It just works so different than the 8-hour school day. And you even see that in ADHD and dyslexia and ADD and the other neurodevelopmental disorders. And I even have friends and I talk to them. They're like, oh my gosh, my kid is making me want to bang my head against, I'm just so upset. I don't know what to do. And it's they're like, but we just have to mold them and not squash out that quirkiness, because that quirkiness leads to greatness.
Yes.
When it's handled, when it's cultivated correctly.
Absolutely.
So we think it's, we're here for it. We're here to help develop that and love them and help families, but we just see it a whole lot.
True. When you look at high-level CEOs, Navy SEALs, all these people that are very high performers, these people typically have ADHD or Tourette's or something like that, that gives them an unevenness in their skill sets that allows them to be a high performer. This is something that I've talked about for years.
Or even swim. Remember when our kids swam and I had moms tell me my kid is on the spectrum. My kid has this, my kid has this. And Nolan would be like, man, my friends can swim all day and they never hurt. And we're like, it's because they're not fully feeling their bodies, but that's superpower they have. Mm-hmm. It absolutely is.
It is.
So it's cool.
Absolutely. Well, what else should we touch on?
I don't know. We just talked for almost an hour.
So that was a good little impromptu discussion. We talked about a lot. Just to kind of wrap it up before we get off here, I'm just going to give you my opinion. So this is conjecture from Brandon Crawford, and I'm not going to make claim that I know it with 100% certainty or anything like this. This is just my observation. So they needed to find something, right? They started this initiative, and I love that the administration and RFK, like they came together, and I love the concept behind this. And I think that RFK is trying to do good work, but along the way, they had to point to something, right? So they started to point, there was already data pointing to acetaminophen. So there was somewhat of an easy target. And so what you see here is, I think acetaminophen, I think Tylenol is being used as a scapegoat personally, because it points the finger at them. And this is, them saying this is causing a problem. So the, one side of the aisle, the holistic side is happy, right? They go, oh, they're finding a problem and it's a drug and this is good movement in the right direction, et cetera. But then the other side of the aisle, well, it wasn't a major finding. It wasn't like, they're really damning vaccines or they're really, finding anything major here that's going to piss off the other side. So both sides are happy, but then at the same time, they're recommending better access to leucovorin, right? So leucovorin is folinic acid. It's a prescription. It's used for cerebral folate deficiency, right? So if your brain is not able to use B9 effectively, then you can take this and it can improve neuronal health, right? Sure. So it's good for some people, right? And so, but it's not a magic cure-all, right? I've had several patients take it and not have a big problem.
A methylated form of B9.
Right. It's a manipulated form of B9. Again, in order to have something be a prescription, it has to be chemically altered in order to be patented. Mm-hmm. And so I argue whole food sources are best. Take your methylated B vitamins and other methylation supporters. And, if you have methylation pathway issues like the MTHFR gene, COMP gene, all these different genes that affect methylation disorders. So it's not just about leucovorin, but there's other B vitamins to consider in this as well. But what I see, and again, my opinion, I think this is a scapegoat. You're going to see a decline in sales from people not buying Tylenol. But I think to counter that, you're going to have an uptick in leucovorin sales. When you look at ownership structures of this, it's all murky. You have conglomerates owning multiple companies, and each of those companies own multiple companies, et cetera. So there's no clear, ownership path that I can really, and I haven't researched it. Again, this is just conjecture, but it just kind of looks like it's a little funny to me.
Yeah.
We are not trying to attack anyone. We're just trying to present data. And some of the things I talked about were my opinion. I tried to point to when I was talking about my opinion or conjecture, but all the other stuff, we were really just commenting on data, factual data that has been published. That's what we're doing. And so hopefully this helped to clarify some things.
Yeah. And if you want more studies, just search acetaminophen and glutathione.
Yeah.
They'll
Google
populate
Scholar.
on Google.
There you go. Fantastic. All right. Well, hope you liked it. If you did, please like, share it, all the things. Looking forward to what you have to say. All right. Thanks.
We hope today's episode has inspired you to take that next step toward your best self. Remember, the path to longevity is paved with small, daily decisions. Your journey is unique, and every step, every choice, brings you closer to your ultimate vision of a healthier, happier life. For more insights, tips, and resources, visit drbrandoncrawford.com.